Sandimmune Ampul, also known as Cyclosporine, is a medication used to prevent organ rejection in people who have received a liver, kidney, or heart transplant. It is typically used in combination with other medications to help the new organ function properly. This medication belongs to a class of drugs called immunosuppressants, which work by weakening the immune system to help the body accept the new organ as if it were its own. It is important to note that Sandimmune Ampul is usually administered intravenously, and should only be used by patients who are unable to take cyclosporine by mouth due to the risk of severe allergic reactions. Once the patient is able to take medications by mouth, they will be switched from the intravenous form of cyclosporine to either the capsules or oral solution. The dosage and timing of Sandimmune Ampul will be determined by your healthcare provider based on your specific medical condition and response to treatment. It is important to follow their instructions carefully for the best results. This medication is administered through an injection into a vein as prescribed by your doctor, typically once a day for a duration of 2 to 6 hours. The dosage is determined based on your weight, medical condition, lab results, and how you respond to the treatment. If you are using this medication at home, make sure to carefully follow all the preparation and usage instructions provided by your healthcare professional. Before using, visually inspect the product for any particles or discoloration. If you notice either, do not use the liquid. Also, be sure to learn how to properly store and dispose of medical supplies. When cyclosporine is administered into a vein, one of the other ingredients in this product, polyoxyethylated castor oil, may rarely cause a serious allergic reaction. If you are using this medication at home, be prepared to self-treat as instructed by your doctor if you experience symptoms of an allergic reaction. It's important to use this medication regularly in order to receive the maximum benefit from it. To help you remember, take it at the same time each day. Side effects of Sandimmune Ampul may include shaking, headache, dizziness, nausea/vomiting, diarrhea, or stomach upset. Unusual growth and swelling of the gums may also occur. Remember that this medication has been prescribed because the benefit to you is greater than the risk of side effects. It may also raise your blood pressure, so make sure to check it regularly. Tell your doctor right away if you experience any serious side effects, such as signs of kidney or liver problems, easy bruising/bleeding, muscle weakness, chest pain, or seizures. If you notice any symptoms of a serious allergic reaction, seek medical help immediately. And remember, this is not a complete list of possible side effects, so always consult your doctor or pharmacist if you have any concerns. Cyclosporine, found in Sandimmune Ampul, may lower your ability to fight infections, making you more susceptible to serious infections or worsening any existing infections. It may also increase your risk of certain types of cancer. Be on the lookout for signs of infection or cancer, such as a persistent sore throat, fever, chills, cough, burning or frequent urination, unusual skin changes, changes in appearance or size of moles, unusual weight loss, swollen lymph glands, unusual lumps, or night sweats. In addition, cyclosporine can cause high blood pressure and kidney problems. The risk of both problems increases with higher doses and longer treatment. Your doctor will monitor your blood pressure and kidney function while you use this medication. If you have psoriasis and have had certain previous treatments, you may be at an increased risk of developing skin cancer. It's important to discuss the risks and benefits of using this medication with your doctor. Before using Sandimmune Ampul, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that can cause allergic reactions. It's also important to discuss your medical history, including any kidney disease, liver disease, high blood pressure, cancer, skin lesions, radiation treatment, mineral imbalance, infections, high cholesterol/triglycerides levels, and any use of alcohol or marijuana, cannabis. Sandimmune Ampul may make you feel dizzy, so it's important to avoid alcohol or marijuana, and to be cautious when driving or using machinery. If you are pregnant, breastfeeding, or have liver disease or alcohol dependence, consult with your doctor before using this medication. It's important to avoid contact with anyone who has an infection that may easily spread, and to inform your healthcare professional before receiving any immunizations or vaccinations. This medication may also increase your risk of developing skin cancer, so it's important to limit your time in the sun and avoid tanning booths and sun lamps. You should also consult your doctor before using potassium supplements or salt substitutes that contain potassium. Before having surgery, inform your doctor or dentist about all the products you use. Older adults may be at greater risk for kidney problems or high blood pressure while using this drug. If you are pregnant, it's important to discuss the risks and benefits with your doctor before using this medication, as it may harm an unborn baby or cause other problems. This medication also passes into breast milk, so consult your doctor before breastfeeding. When taking Sandimmune Ampul, it's important to be aware of potential drug interactions. Certain medications and herbal products may interact with Sandimmune Ampul, affecting how it works or increasing the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist to avoid any potential interactions. Some products that may interact with Sandimmune Ampul include coal tar, orlistat, other drugs that weaken the immune system or increase the risk of infection, drugs that may increase potassium levels, and tacrolimus. Additionally, other medications can affect the removal of Sandimmune Ampul from your body, which may affect how it works. Examples of affected drugs include bosentan, mifepristone, St. John's wort, ritonavir, among others. It's also important to note that Sandimmune Ampul can slow down the removal of other medications from your body, which may affect how they work. Examples of affected drugs include aliskiren, dabigatran, dronedarone, certain statins, and voxeloprevir. Be sure to discuss any potential interactions with your healthcare provider before taking Sandimmune Ampul. If someone has taken too much Sandimmune Ampul and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, while in Canada, residents can call a provincial poison control center. When using Sandimmune Ampul, it is important to undergo regular medical and lab tests to monitor kidney/liver function, blood pressure, blood mineral levels, cyclosporine blood levels, complete blood count, uric acid levels, lipid levels, and skin exam. It is crucial to attend all medical and lab appointments and consult with your doctor for more information. For those who have had an organ transplant, it is recommended to attend a transplant education class or support group. It is important to be aware of the symptoms of organ rejection, such as feeling ill, fever, and pain around the transplanted organ. It is also important to be familiar with the signs of a failing transplanted organ, such as a decrease in the amount of urine with kidney transplant, yellowing of the skin/eyes with liver transplant, and shortness of breath/inability to exercise with a heart transplant. If any of these symptoms occur, it is important to seek medical help immediately. Remember to take each dose of Sandimmune Ampul as prescribed by your doctor. If you happen to miss a dose, make sure to consult with your doctor or pharmacist to create a new dosing schedule. It's important not to take a double dose to make up for the missed one. As for the best time to take it, follow the instructions given by your doctor. Be sure to follow the product instructions and consult your pharmacist for proper storage information. It is important to keep all medications out of the reach of children and pets. Do not dispose of medications in the toilet or drain unless directed to do so. When the product is expired or no longer needed, make sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.